So what do our students study during training? Our 3 years are packed with lots of exciting things that our students study. And actually, because the way that we organise it, the 3 years fly by so quickly. And when we talk to students, they'll often say, I can't believe I'm in year 3. So let's look about the theoretical side of things. So half of the 3 years will be spent in theory. So it'll be spent in the university. So students will experience large lectures, and you can see on my picture up below, this is actually one of my lectures. I was talking about infection prevention and control and the importance of hand washing and using PPE. This is an example of a large lecture theatre, lots of students, and the presenter and the lecturer will generally deliver a PowerPoint presentation and have a discussion. So beautiful lecture theatres with really good high quality audio material there. We also do small tutorials because, again, we know that especially in nursing, we need to have small discussion groups to work out problems and issues that we find in clinical practice. So we'll do smaller tutorial groups of perhaps 10, 15 students, and that enables students to mix, to speak with each other, to debate in a more comfortable and safe environment. Because we know in a big lecture theatre, if you've got a question, sometimes it's very intimidating to put your hand up and ask a question. So this is why we do a lot more smaller tutorials as well. And it allows students to get to know each other very well as well. And they're lots of fun, and we can have a great deal of discussion. We also supplement our learning material with online material, and we go through the students on My Dundee, which is our platform that we use to explain how to access all the learning material and reading material. At the moment during COVID, we are delivering a lot of our lectures and tutorials online because, as you know, all the universities closed down, but we're in a very fortunate position in the UK that our vaccination programme, we've just about vaccinated the whole of population in the UK, so it's very far advanced, and we are delighted that we are opening the university for the new semester in September, so we're back to teaching face-to-face, which we absolutely cannot wait, because being on campus and teaching our students and meeting them face-to-face is just wonderful. There'll also be, in part, there'll be self-directed study, because we wouldn't expect students to come in every single day from 9 o'clock to 5 o'clock. We will be giving them self-directed study where they can go away and work with their friends, in pairs, in the libraries, in their accommodation to do self-directed study. We also have skills and practice modules. So what happens then is our students would go to 9 Wells Hospital, which is our local hospital, but it's the biggest teaching, one of the biggest teaching hospitals in the UK. It's huge with all the different specialities you can imagine. And we have a fabulous simulated area. You'll see in the top photograph there, this is one of our sections of our simulated clinical areas. So this allows us to take our students into this area, and it's built like a real life ward, a real life department in clinical practice, but we can do some safe teaching where they can start to build their confidence and be competent in a clinical practice before they go out and practice on real patients. Lindsay in the middle, who's sitting on the bed, she's one of our lecturers, so she's pretending to be a patient, and she's teaching our students. What we also have is we have real life members of the public who come and pretend to be patients and allow us to do our teaching. So it's very much a real life situation. So we got lots of different clinical skills that we work with students within the simulated laboratory. Another thing which is really good and our students get a lot out of is our interprofessional education, which we also do in clinical skills in the hospital in that area, is that we teach our nursing students alongside our medical students. Now, initially, when we say this to our nursing students, they feel a bit daunted and they think, oh, I can't learn anything with medical students. But actually, it's great fun. And I love it because when we do things like we do infection control, we do manual handling, we do blood pressure, temperature, all these kind of things and communication skills with the medical students. And I love it so much because actually when we get in there, our nursing students learn so much more and are so much more competent than our medical students. So actually our nursing students teach the medical students a few things. So they really have a good experience. But what this also does is when the nursing students go into clinical practice for their placements, they'll recognise a lot of the medical students because they've worked with them and studied with them. So it makes them feel much more relaxed and part of that multidisciplinary team I was talking about before. So that's our interprofessional education, and that will continue throughout the 3 years as well. We have amazing library facilities on campus. We have a huge library on, I think, 4 or 5 different levels. We've got lots of different pods, different rooms that students can use, quiet areas, areas that they want to study with friends. We've got lovely cafe and eating facilities in there as well. So a lot of our students go there for when they're doing their self-directed learning. Within theory as well, we have a huge amount of academic support, because that's another question that I often get from our international students is, you know, what support is there for me academically? So every student will be allocated to an advisor of study who will be a lecturer at the School of Health Sciences and will be their support person for the whole 3 years. So if they need support for anything at all, they go to this person. So they'll get to know the person very well. We have a fabulous academic skills centre. So if any of our students are struggling academically with assessments, with academic writing, with English language, anything like that, they have access to everything in the academic skills centre. They can get one-to-one help or they can get group help, and it's all free of charge because they're a University of Dundee students, so there's loads of help. The librarians as well will help students with searching for articles, with all that kind of literature searching within the university. So there's lots of academic support as well. I wanted to mention about the learning teams. So when students are in theory and in practice, right from the very beginning, they'll be allocated to a learning team, which is about 20 students. So you can imagine, as I said before, with 500 students, that's a lot of students. So we divide students into small learning teams with the academic advisor and the who will be the academic support. And those learning teams will be generally who students will study with in the small tutorials. So they'll get to know each other really well and they'll get comfortable with each other. And lots of our learning teams create a WhatsApp chat. They'll chat on Facebook and things to give them each other support. So that's a really good support network throughout the 3 years. As I said, they'll have the academic advisor. The Associate Dean International, which is myself. I meet up with our international students on a regular basis. I get the fun part because I get to go out for coffee, organise lunch, and we're currently organising a summer trip to Edinburgh. We'll take a picnic and jump on the train and go to Edinburgh in a few weeks' time. So I get the fun part with the international students, which is really great. So our students will get to know me really well as well. And I just wanted to, at the end of the theory section here, let you know about assessments. Obviously, students don't really like assessments. Nobody really likes assessments, but they are really important to make sure that students are progressing and they're passing the coursework to enable them to be safe in clinical practice. We'll give a lot of support to do assessments very earlier on, again with assessment writing, with academic writing, and any help that the student needs to review draft work. Most of our assessments are written. There's some presentations, the different group discussions. So we have a range of exciting assessments, but we do provide a lot of support for that. And the way that theory and assessments will work, just before I talk about the clinical placements, is although I say it's 50% theory, it's spread out over the 3 years. So to give you an example, in September at the start of the semester, students will come in and do, say, a block of 12-week theory. So they'll do their theory, which includes simulated practice. Then they'll go out to clinical placements and do maybe a few weeks clinical placements, maybe 6 to 12 weeks. And then they'll come back to the university and do some more theory. So it's a developmental, it's stepping up each time they come. So that's a great way how they build their confidence and their competence. So it's really theory, practice, theory, practice, theory, practice, right throughout the 3 years. This is just a photograph of our one of our simulation wards. So as you can see there, we've got people in beds that look like real patients. So these are members of our public that are coming to help us with teaching our students. And as you can see, our student nurses are there with the medical students. So this is an interprofessional education situation that's going on here. I think this is around communication skills and admitting a patient, because we know in clinical practice, student nurses will be involved in admitting a patient from the nursing care side of things, but they'll have to work closely with medical students and medical staff on the admission process. So this is us teaching us how that might work. So as you can imagine, then when students go into clinical practice and are actively doing admission processes, when they see a medical students that they've met before, then it's much easier and it's a nicer situation for them to be in. So it's a great simulation laboratory that Okay, so let's look at clinical practice. So as I say, with the 50% theory, it means that they'll be in placement for 50% as well. And this is fantastic because it means when students finish at the end of the 3 years, they will have experienced a huge range of different experiences in clinical practice. So when they become a staff nurse, a registered nurse, they will be ready for it because they've had so much time in clinical practice. We offer a huge range of placements. So students can go into acute hospitals, mainly 9 Wells Hospital, which I mentioned earlier, and they have medicine, oncology, hematology, orthopedics, surgery, A&E, they have infectious diseases, lots of theatres, neurology, just everything that you can imagine. I worked in 9 Wells for over 15 years as a qualified registered nurse, but also as an infection control specialist nurse, and it's a fabulous hospital. The staff are lovely, and even coming out of the pandemic, we know the pressure that healthcare professionals have been under during the COVID pandemic, but our nurses and our healthcare professionals in 9 Wells are so enthusiastic, and they're great to work with and great to learn with. So there'll be opportunities for acute hospitals in the specialist areas that I've mentioned. Also in community areas, student nurses learn a lot in community nursing, and it's different kind of nursing. So we'll place them out in community settings, in care homes to look after the elderly, in GP surgery, so they'll work with practice nurses, they'll work with health visitors, lots of different ideas. And it's funny because often if our students have had really nice placements early on in the program, they say, this is what I want to do when I'm qualified, this is definitely for me. But then they go to another clinical placement that they haven't expected, and they're like, oh my gosh, that was amazing, this is what I want to do. And then by the time they're registered, they're like, I've loved it all, I don't know what I want to do. So having that experience is great fun. And I recall all my clinical placements as a student nurse, and I loved every single one of them for all different reasons. So the allocation of placements, students don't need to worry about that. We allocate placements for them because we have that contact with all our placements. So, and we tell them in plenty of time to allow students then to make contact with the clinical placements to find out where they are, how to get to the placements, what their shift pattern is, etc. So that's done well in advance. In terms of support, every student will be given at least one clinical mentor, sometimes two. So this will usually be a registered nurse who will take care of the student and help them work through their objectives and make sure that they're achieving their competencies as required. And they'll work with the student on the shift. They might not work with the student every shift because the student will get a chance to work with all the healthcare, the multi-healthcare disciplinary team. They'll learn things. So they'll learn all about communication skills, they'll learn lots of different clinical active skills, they'll get a chance to see specialist areas, go to theatres, to see surgeries. A huge amount of learning will happen. And then it's really good because after that learning, they'll come back into theory to consolidate that with the theoretical underpinning. So it all works really well. And as I said earlier, students, even as a first year student nurse in a very first ward, they will be treated like part of the multidisciplinary team. They will be treated as they're valued and very well respected. And it's important that we monitor that. If a student has any concerns or they're, have any worries about their clinical placement, then we deal with that in a really respectful and professional way to make sure that their experience is of a really good standard. That's really important to us.